In part 1 of this series, we talked about how photobiomodulation works, how it supports mitochondrial function, blood flow, inflammation, tissue repair, and the environment where eggs and embryos develop. If you haven't watched that one yet, I recommend starting there, but don't worry, you'll still be able to follow along if you haven't yet. Bookmark it for later though, because it's so fascinating. The proposed mechanisms are promising, but the real question is whether they actually translate into better fertility outcomes. So today, we're looking at the research on photobiomodulation and female fertility. We'll go through some of the key studies, what they found, where the limitations are, and what I think we can reasonably conclude based on the evidence we have today. And there's not a lot as it pertains to female fertility, but I do think it's promising. And in the next video, we'll cover males, by the way. So first, let's start with the Giga Laser protocol. Since 2012, a clinical series using the Giga Laser device treated 400 infertile women aged 34 to 50 years. Most had already tried different types of ART like IUI, IVF, and or lifestyle changes with no success. The protocol was this: starting on day 1 of the woman's period with 6 treatments over 2 weeks, timed so that ovulation and insemination, natural or otherwise, occur at the end of that window. Then if conception didn't occur and menstruation returned, another course was given. The treatment itself was a Giga Laser placed directly over the abdominal area, 1 to 2 centimeters above bare skin. Each session was 23 minutes, delivering a total dose of 20,000 joules. 15,000 joules of near-infrared laser light, or NIR, at 808 nanometers, that's the wavelength, plus 5,000 joules of red LED at 660 nanometers. And the outcome: out of 400 women, 260 conceived. That's 65%, in a population that had already failed other interventions. Now, this is a clinical series, not a randomized controlled trial, so we have to keep that in mind. But I think those are some pretty amazing results for a natural, non-invasive treatment. Next, I'm going to go over a 2024 case series where 3 women with infertility received multi-wavelength photobiomodulation, including 810 nanometers of near-infrared. They used a class 4 laser for this case series. Protocols targeted the abdomen and pelvis, lower back, and gut support areas, and all 3 achieved an alive birth. The authors propose mechanisms we covered in the first video: improved mitochondrial ATP in the ovary, reduced local inflammation, so your TNF-alpha, IL-6 and IL-1 beta, and better endometrial receptivity. If you want to read the studies, by the way, I'm going to leave them all in the caption. I think this one is a very interesting read. It kind of reads like a story. The first case covers a 41-year-old woman who had 4 years of unexplained age-related infertility and no contributive medical conditions. 6 cold laser sessions were performed prior to the first egg retrieval, which resulted in 2 normal embryos through PGA testing, which most couples would be thrilled with that result at above 40 years old. Then 12 cold laser sessions were performed between the first and second retrieval, which resulted in 1 genetically normal embryo. Then she had 2 final PBM treatments prior to the transfer, which resulted in a full-term pregnancy and birth of a healthy baby. In the second case, a 40-year-old fit and healthy female with infertility for 2 years had 4 successful IVF cycles. She received 5 photobiomodulation treatments leading up to her 5th egg retrieval, and then she had a fresh transfer that resulted in a full-term pregnancy and birth of a healthy baby boy. The third case is particularly interesting to me, with a 42-year-old woman who had 2 miscarriages over 3 years, and unexplained age-related infertility was assigned to her. She underwent 5 unsuccessful IVF cycles prior to this study. So 12 PBM treatments were given over 2 to 3 months before her next IVF cycle. While no embryos were normal after PGTA testing, she used a stored euploid embryo for the next transfer, which was not successful. But then the patient did 3 more PBM therapies, PBM or photobiomodulation, and she had a natural conception after that, which led to a full-term pregnancy and birth of a healthy baby. In this case, they did use cold laser to support pregnancy as well. They avoided the pelvic abdominal region. You can read more about what they did in the article. It's pretty interesting. Obviously, 3 patients don't prove the effectiveness of this therapy, but case reports often help generate new research questions, and clinical outcomes should be taken into account. Another interesting study is this 2024 study looked specifically at women with recurrent implantation failure undergoing frozen embryo transfer. This was a double-blinded, randomized clinical trial, and the first to assess the effectiveness of low-level laser therapy, or LLLT, interchangeable with photobiomodulation. There's a lot of names for it. But this was the first randomized clinical trial to assess the effectiveness of this therapy in individuals with recurrent implantation failure. Double-blinded RCTs like this are the gold standard for research, so something to keep in mind. So the average age of the subjects, or women, in the study was about 34 years, and they had a history of recurrent implantation failure, having undergone 3 to 7 previously failed embryo transfers. The average duration of infertility among the control group was 7.6 years, and of the laser group was 7.8 years, almost 8 years of infertility. The women received 6 sessions of low-level laser therapy on days 2, 4, 6, 8, 10, and 12 of their menstrual cycle, and in the very next cycle, the embryo transfer occurred. The results were that low-level laser therapy improved biochemical pregnancy rates, 46.7% versus 33%, as well as clinical pregnancy rates, with 33.3% versus 20% compared to the control group. This was the first randomized controlled trial, but the sample size was small with only 30 participants. But the authors concluded that low-level laser therapy enhanced uterine blood flow and endometrial receptivity, confirming what clinicians using this modality have observed for years. Something I think about is the fact that the treatment occurred and then the embryo transfer occurred immediately after. I think, what if we use more than 6 treatments and in more time leading up to a transfer, an egg retrieval and a transfer, to give the beneficial effects of the therapy time to occur? So that's where my head goes with that. The next study I want to touch on used photobiomodulation in naturally aged mice. And the results showed that low-level laser therapy recovered levels of sex hormones, increased the number of primordial and growing follicles, improved angiogenesis or blood flow, and decreased cell apoptosis or cell death in the ovaries. It also reduced oxidative stress, inhibited chronic ovarian inflammation, and improved mitochondrial function in aged ovarian tissue. So the authors concluded that the mechanisms underlying PBM's benefits in ovarian aging include antioxidant effects, inflammation reduction, and preservation of mitochondrial function. And this is a mouse study. So animal studies don't prove what happens in humans, but they do allow researchers to directly examine ovarian tissue, which we obviously can't do routinely in people. But the results do, again, align with what we see clinically. So I thought that was really interesting. And one more study I want to mention is probably the most well-known. It's older, but it's important data from Japan, where Dr. Oshiro reported on severely infertile women, average age around 39, many with years of failed ART, with an average of 9.13 years of infertility. Where the other studies include mostly treatment to the abdominal pelvic region, in this study, what's called the proximal priority technique was used, where they treated the neck rather than the pelvic or low back region to improve systemic blood flow. So they only treated the neck in this study. And severely infertile patients were treated with 830 nanometer low-level laser using this technique. And in the first 74 patients, the study was actually extended to include more. So in the first part with 74 patients, just over 21% conceived, with about 2/3 of those pregnancies resulting in live birth. In the extended series of 701 patients, roughly 22% conceived, and about half of them had live births. The device was a low-power 830 nanometer diode laser, and patients averaged around 21 sessions. Now, if you're thinking, well, around 20% conceived and half had live births, maybe that's not that much. Here's what I think. I think this study is interesting because it shows that even with much lower energy per session than, for example, the Giga laser protocol, repeated near-infrared treatments can improve outcomes in a very difficult population, and they treated only the neck. I think these are pretty good outcomes for the area treated, and there's no mention of addressing any other aspects of fertility. I think, what if we use this therapy to complement comprehensive fertility optimization, and we address DAD, which there's no mention of in these studies, and remember, male factor is involved in literally half of fertility cases. What if we help with nervous system regulation and pelvic mobility and run comprehensive labs to see where your body needs support? What systems do we need to improve function for? What are other root causes we can identify and address? Where can we reduce drivers of dysfunction and inflammation? What nutrients do we need to support? Nutrition we are heavy on, at least in my work. And add photobiomodulation to improve egg quality and the uterine environment and endometrial receptivity. In that study, treating severely infertile females, only the neck was treated. But based on the mechanisms, I would want to, and I do treat directly over the reproductive organs to help with not only blood flow, but mitochondrial function, egg quality, and uterine health, endometrial receptivity. But anyways, here we have human studies, a randomized trial, case series, an animal study, and decades of clinical experience, all pointing in a similar direction. Photobiomodulation appears to support the physiology that reproduction depends on. So I don't think photobiomodulation or cold laser is a magic bullet itself. These studies are still relatively small, protocols vary quite a bit, and we still need larger, high-quality clinical trials. But when we look at the mechanisms, the safety profile, and the clinical outcomes together, I think photobiomodulation is one of the most promising complementary therapies we currently have in fertility care. I think it can be very supportive, and especially when used in a protocol that addresses the rest of your body and fertility. When we use this therapy in our clinic, we do start with treating the neck to improve systemic blood flow, and then we move to directly treat the abdominal pelvic region, and we also treat the low back. I hope you found this information as interesting as I do. In the next video, we'll take a look at what the research says about photobiomodulation and male fertility. So I'll see you there. Don't forget to like, subscribe, and share with somebody who may benefit from learning this information, or if they're just nerds like us and like to learn.